A Kultured Kast has been created for entertainment and educational purposes. The advice given are opinions of our host and not of medical advice. The podcast is not a substitute for direct, personalized, professional medical care and diagnosis. Exercises and dietary advice mentioned should be discussed with your physician or personal trainer to find out what is best for you. Welcome back to the latest episode of the Kultured Kast, reintroducing Big Papa Mac, also known as Zaddy, or Zaddy-licious, and Pro Fit Performance Training. I'm G Zaddy, Grand Zaddy, and not geriatric Zaddy, smartass, before you chime in from the side. And then we've got our new child model from Oshkosh Begosh, CJ Fitness, pretty boy, modeling ages 2 to 4. Welcome back, Doc. Having you back for the second time. Yeah, I couldn't wait to say that, John. I really couldn't.
You guys had a pre-conference.
So yeah, we had this.
Yeah, that's why I was leading up to it with all these Oshkosh comments all week. Yeah. I walked up to his client because someone brought a shirt in, and I'm like, "Yo, your Oshkosh order's here." And his client just dies.
I had no idea.
He's like, "What's Oshkosh?"
Yeah,
I've been like,
"You're the cover model."
The last couple of years, it's been Baby Gap. So
it was Baby Gap.
It was Baby Gap, but you graduated to Oshkosh. Dr. Grant, welcome back. Sports specialist chiropractor, Wilfrid Laurier grad with Kin, I believe, honors Kin. Yep. You also graduated CMCC, Canadian Memorial Chiropractic College, Sports Science Division. We talked about many different topics about your experience with national level athletes last time. We talked about the generic Jane Doe, John Doe practice you have too. There's a few other topics that we really want to discuss. And I'll open up by saying, correct me if I'm wrong, I think there's 5 or 6 modalities that are actually allowed to diagnose. So you've got your GP or your medical, your dentist, your psychiatrist, I believe. Is podiatrist and like a foot doctor on there too, or?
Ooh, that's a good question.
Yeah,
I don't think so.
Okay, because I know there's a limit, correct?
Yeah.
Like, so medical psychiatrists, obviously psychiatrists already have an MD, chiro, dentist, optometrist, I believe is one as well. Where does a chiropractor fit into that? Versus where do they fit into with a naturopath and an osteopath and people that are not legally allowed to diagnose? Where does your practice fit into that?
Yeah, so that's a good question. So being able to diagnose, like our area of expertise is in that musculoskeletal realm or maybe neuromusculoskeletal realm and dealing with the spine and then all the joints and muscles around that. And so we have that area of expertise that we're really good at assessing injuries related to the spine, related to the joints, related to muscles. And so we're probably, of those like 5 that you named, just one of the strongest within that category. So we can work really closely with the medical doctors and nurse practitioners and hopefully like continue to be more involved with them because there, there's kind of been some animosity historically between some of those professions, but we're seeing it more and more where chiropractors are working in the same offices as medical doctors. And so that kind of referral back and forth between the two can be really helpful because the medical doctor is like the gateway or a nurse practitioner is like the gateway into the medical system.
Yeah. And I apologize for leaving out. Nurse practitioners can as well diagnose, correct?
I think so. Yeah.
Yeah.
Yeah, definitely.
Think so. Yeah. I didn't mean to leave them out, by the way.
So patients are going into them and then often needing to get sent to somewhere else, whether that's to like some type of specialist or whatever for their treatment, that whatever they're looking for. And so I think chiropractors can be a really good resource for them to use in that musculoskeletal realm, which currently is like held on to very strongly by physiotherapy. And like, there's nothing wrong with the physiotherapy, but it's just like very common that like you come in with, I don't know, like a swollen knee or something, and they're like, go do physiotherapy, right? Like you very rarely hear that it could be a chiropractor. And so I think that that's one area where I would like to see it grow.
Yeah, for sure.
And then each one of those other ones has their area of expertise, right? So like I have patients that I have kind of shared roles with, like say for an optometrist, like the patient that comes to mind is like one who has a concussion, right? Sure. So I'm dealing with the neck injury, whiplash portion of that concussion, and they're dealing with like the visual training aspect, but both of those can be creating their symptoms, right? And so same thing with like somebody who has like TMJ, temporal mandibular joint dysfunction. So like they're often dealing with the dentist to maybe fix their bite or get like a mouth guard for sleeping or something, but I might be working on like the muscles of their jaw to try to help get their headaches and jaw pain to relax from that perspective. So we all kind of have like our own little piece, but there's significant overlap between all those pieces.
So you're talking recently, nurse practitioners have actually been started or have began to give the credibility in that industry that they should have long since had.
Yeah.
Chiros, I believe, are now slowly becoming more recognized as legitimate. And listen, to last weekend at a family function, I said, you've got to go see a chiropractor. It's incredible. My stepson's like, I'm not going to see that quack. I'm not going to get cracked. I'm like, okay, first of all, you're giving me a friggin' headache, but you're not getting cracked. You're not being seen by a quack, but it's this rain cloud that's over your profession that quite frankly pisses me off. So we're not going to be nice today, Doc. The idea is to bring you back on here to say, like, wake the fuck up. Like chiropractors, sorry, but I'm being serious. Wake the fuck up. Chiropractors have something to give. A guy my age, I just turned 56. I got fucking parts of my body that are falling off and parts that hurt that I didn't even know I had before.
I can hear you squeaking from here.
Honestly, it's my chair. Fuck off. It also might be my left hip.
One of the two. Definitely.
Right? But the first thing that happens if I go to a family doctor or even some specialist, they're like, okay, hold on, let me write this script and go, well, fuck off pharma. I'm done with pharma. I'm so done with pharma. And you watch TV, especially American TV, you watch anything else, every other commercials, hey, took this, like the fact that they're pushing Ozempic now as a weight loss drug. We'll fucking get into that later because I'm going to lose my shit about that. But they don't give you guys enough credit that you can alleviate what I'm going through. And I don't have to have a needle in my body.
I think because there's not enough money going into the
100%, pal. It's all about the mighty dollar. It's not actually about my end health. It's not about my longevity of life or my quality of life, where I happen to believe your practice and your profession does. So for the layman terms, and we talked about this just before we started filming, what exactly does a chiropractor do for me?
Yeah. So I would say the biggest two things that we do are improving motion and decreasing pain. So like I see a huge percentage of my patient load is they come in with some kind of pain, whatever that is. And so we're trying to decrease their pain and figure out why they have that pain. And that can be a whole bunch of different treatment options to get to that point, right? Like adjustments are certainly one of the things that people know chiropractors for and like very commonly used, but it's not the only thing that chiropractors will do. Like a lot of us have training in acupuncture, some form of soft tissue therapy. Like I do active release technique, giving them like rehab exercises. And then even the education piece is like pretty important, right? So if somebody comes in and they have a sore hip, they got a squeaky hip. Yeah. Right. And so
thanks, Jeff.
it's kind of explaining to them like, why do they have that squeaky hip and like not letting that be their identity, that like, we can probably make that better. Right. So that piece plays a big role too.
Okay, good.
So why is it that chiropractors and their methods are often looked down on or discredited?
Yeah. So I think there's a lot of things leading up to that, like historically. So first, like when chiropractic started, it didn't have an area to go into, right? So these people became chiropractors and then they were arrested for practicing medicine without a license. Oh, wow. Because they were treating things that the medical doctors were treating. And the medical doctors are like, well, you're not a medical doctor. And they're like, yeah, I'm a chiropractor. But what is a chiropractor? Like it's brand new at the time, right? So these people were being arrested for practicing without a license. So that's one area that kind of just like drove a little bit of a wedge between us and medical doctors. There is a risk of having a stroke when you get your neck adjusted. So extremely rare risk, but obviously a very serious risk. And so there have been cases where that has occurred, and that has just been like, don't ever go see a chiropractor because this could happen kind of thing. And probably historically, like the rate of people having their neck adjusted, I would imagine was a lot higher than what it is now. Like I adjust people's necks, but when they have a neck issue, not like every single person is.
Yeah, exactly. And if they're okay with it.
Yeah, exactly. Right? It's a conversation.
I went to a chiropractor when I was a kid, and he was actually a family member, and he cracked my neck without me even realizing he was going to crack my neck. I ran out of that office screaming.
Was it the sound or the feeling?
It was the sound and the feeling. Like it took me by surprise. Like he's just kind of wiggling my neck, and I'm like, oh God.
Yeah, you have no idea.
But now, like I'm aware of it. I love it. My neck is always stiff because that's where I put my stress. And he cracks my neck, and I'm like, that's the crack I get these days.
Yeah, in defense of my stepson, because I love him,
The transition.
that's what absolutely scares the hell out of him.
For sure.
He's heard the feeling, like I'll crack my wife's back with squeeze the bear hug, and that just scares the just bejeebus out of him, right? So that's why he won't go see him. So I get that, right? Because that's been drilled into our head that our body's not supposed to make that sound.
Yeah.
Well, why is it making that sound?
Well, have you seen the TikTok videos where they're teaching people how to crack people?
I mean, yes and no.
So
I
there's
definitely,
one where I would stand, if Corey's here, I would grab his knee, he would lift it up, and then I would grab his opposite shoulder and pull separately and do a full spinal crack.
Yeah. So I have seen some of these.
Yeah.
And so
what's the thoughts on that?
And can we try it on Corey with your
don't
supervision?
try that at home.
Yeah.
Try
or
it.
on the podcast.
Yeah.
Don't try it.
Oh, no, we may be trying. We got space back there.
Yeah.
So the legal side of that is that that adjustment is what's called a protected act. So the same as giving medication is that's a protected act.
What does that mean?
That only certain people can do that. It's legally other people can't be adjusting. So say for example, Jeff was a physiotherapist at my clinic, and I had a patient that I couldn't fit in my schedule or something. So I'm like, go see Jeff. And then I'm like, okay, this is what I do with him. And I'm like, Jeff, do the adjustment I just taught you how to do. Jeff doesn't have the formal training to do that it would be technically illegal for him to do that. Now, not that physiotherapists can't adjust either. They can do additional training in it. And actually a lot of practitioners can do it within their scope. It's just that they don't do it regularly, so they're not comfortable. So medical doctors actually can adjust, it's within their scope of practice. Naturopaths can as well. Physiotherapists with additional training can as well, and chiropractors obviously do. So yeah, that's kind of the first part. The other thing I would say is there's risk, right? I make you sign a consent form to say what we do here is trying to help you, but
this could happen.
It could make things a lot worse.
Yeah.
And so going into it without having that education as to what could go worse and why could it go worse is the risk that.
So say I did that to Corey and he got fucked up. What could happen to me? Could I get in some serious shit? Because
why are you asking that?
Well, no, is it criminal or civil? And how much exposure does the podcast have if Corey gets really hurt in the next 10 minutes?
So
Can he get
as a general layperson, I would say you probably wouldn't really get into any trouble, but it's more when a professional is doing that.
Tries to do something they're not supposed to be doing.
Exactly. Yeah. Okay. That's when they'll run into issues.
So I've been to a chiropractor one time. It was 10 years ago. So I have one experience with a chiropractor. Back crack, neck crack, and I was the same as
adjustment.
Yeah, adjustment. So I was kind of the same as who Ty was talking about, where the sound kind of freaked me out. But I don't know if that was a good experience or a bad experience, because I've never had a chiropractor before. Would you recommend that someone always maybe tries out a couple different chiropractors before kind of settling on one? Or is there a situation where someone should just know if this is the right guy for you?
I think that a little bit of shopping around is good, but you don't want to be just constantly bouncing back and forth. So it's not something that is in general is a one-time fix, right? Because, maybe you had a stiff back because you do this movement regularly all the time. So you might've got treated and it feels a little bit better, and then you go back and do those same things and it gets sore again. So you want to be able to work with somebody for a little bit to say what we're doing here is achieving something. But if you're at one time that you go and then it's you can't make your decision for the next 20 years based on that one time, right? So a person comes in new to the office, they have a sore back, and I'm okay, let's try this out. I'm going to see you for once a week for 4 weeks. If we've made progress here, let's continue down that path. If we haven't made progress, I'm not achieving this thing, either I need to change up what I'm doing, or maybe you need to work with somebody else.
Yeah, kind of the same with a personal trainer, I guess.
Yeah, right? Yeah, totally.
Yeah.
It's you don't want to be bouncing around all over the place, because then you'll kind of be in your head, I've seen 10 different people, none of them are able to get me better. This is impossible to solve.
Google.
Now when I
seriously, right?
When I
Dr.
had,
Google.
Yeah. Now when I had my one adjustment, and I didn't end up going back, in my head I was was that just not a good chiropractor, or do I just not like having the adjustments done? I didn't know which one it was.
Why didn't you go back?
I just didn't like the, I just didn't.
Oh, you didn't like the sound and the feeling?
Yeah, I didn't like the experience.
Yeah.
Right. So in my head, I'm like, do I just not like getting, you know, my back cracked, or do I not like, you know, getting adjusted, or am I just maybe not with the right person?
You probably need to go to like a child's chiropractor.
Yeah.
Like a little, I don't know.
Yeah.
If that exists,
Like a little hands chiropractor.
Yeah.
I'll grab a card after.
Yeah.
Why? I don't think we have one.
Not specifically.
Yeah.
So I have a anatomical question. So I tend to, when I start lifting heavy, especially a pull, I'll pop 2 or 3 ribs every time.
Yeah.
And then I go back to Dr. Mike Nicholas, is my chiropractor. And the first thing he says is, you're doing pull again. I'm like, yeah. Is there something that it's predetermined? Is it the function of my exercise that I'm doing? Clearly, probably maybe lifting too heavy, or is it something posturally? Or is it like, which, I guess my longer run question is the musculature in our body more stronger than the skeletal system, or can they counter each other? Is my muscle pulling my rib out? Or is it because my muscles are strong that are weak that my rib is coming in?
Yeah, I would say it's probably some form of like imbalance.
Okay.
So say like pull, you mean like row type stuff?
Yeah.
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 And so, yeah, like those bigger muscles are probably overpowering some of your like smaller postural muscles. So like say, you know, maybe you have like a poor ability to stabilize, like using your diaphragm or like do diaphragmatic breathing and stuff like that. And so those bigger muscles, like as they pull and as they attach onto the ribs, yeah, they can create irritation of those joints. And so that might be what's occurring there. The muscles are capable of like creating a big enough pull to create shift in the joint for sure. And everybody has different kind of flexibility levels with that too, right? Like, you know, somebody who is an overly flexible person, like they need that ability to like co-contract on both sides of the joint so that they create stability, not just like one side pulling so far kind of thing. So yeah, that's kind of like my, I guess, broad answer to that.
And can you educate the listener and the viewer that the idea, because you use the term imbalance. So if let's say my lats and traps are way overpowering my rhomboids and I have really weak rhomboids now, my ribs are popping out because there's no stabilization there. Mm-hmm. That quite potentially could fuck up right up to my cervical and right down to my left SI joint, correct?
For sure.
Right. And that's where I think people don't associate, like, oh yeah, that's not the same. Well, yeah, it's like the old song about the leg bone is connected to it. Yeah. It's true. Yeah. So can you educate the layman? I'm like, the idea of imbalance and what could it lead to? Like, and I'm more referring to you because you went once. Well, I've never ever, when I've had an issue, and I'm really bad. I'm not like you. I don't go weekly. Yeah. I'll go see Mike when I'm in pain, and then I see him for 3 weeks straight. I'm good again until
that
idiot point turns. Right? And
now I'm like, okay.
And people don't practice chiropractic in a preventative way enough, and that's just my personal view. Yeah. But I think of you haven't been back because you didn't like experience, but you probably still have the same problem. You're just fighting through it because you're a tough kid.
Oh,
right?
You still can't touch his
100%.
toes.
That's right. Great point. Yeah. So the imbalance, I guess, is what I'm asking. That layman person needs to be educated that if you're imbalanced, your body's not going to correct itself on its own.
Yeah. Yeah. I mean, I think that there's the power for you to correct it on your own through like at the right exercises.
Yeah.
But like even just getting the education of like, what are those right exercises is an important piece. And like, maybe that's something that you would prefer. Like I have some patients that like, I don't technically treat,
right?
Like I don't put my hands on them, you know, because that's not what they're interested in. And it's more like educating them. How can they do these exercises to prevent these things from flaring up or to prevent an injury or reduce the risk of that injury. Just to talk about like, I guess, muscle imbalances, like, and the connection between areas of our body. Like first off, like some of those muscles are huge, like your lats, right? Like it's spanning basically all the way from like one hip to the other shoulder.
Right.
And so, yeah, for sure. Like you can have an issue there that is giving you back pain and maybe a shoulder injury. But then from like the connective tissue or like fascial perspective, like now we know that there's like so much more connection, right? Like in dissections, like when we go through cadavers, like it used to be like, this is the muscle, right? And it kind of started here and stopped here. And now we have the capability to show these fascial lines that like this muscle connects into this muscle. And like, it actually like envelopes everything. Like it wraps and envelopes our muscle and then goes around our bone and it goes around our organs and everything. And so there's these connections all over the place. And so, you know, with you, like can I say, wait,
oh yeah.
Okay. So like, like a knee issue and like, I'm not really treating his knee that often. Like I'm treating his hip and his ankle. And,
Mm-hmm.
so yeah, to me, it is like looking outside of that direct area of where it is actually sore.
Yeah. And do you agree? Like typically a layman or a person going to see, they don't get that. They don't get that. It can lead to other imbalances in your body.
It's so right when you say that people really don't know what a chiropractor is.
Yeah.
Because I've learned a bunch since talking to you last episode and today too.
And like I've even had almost like little disputes with people where they're like, my shoulder's sore. And I'm like, okay. And then I like start working on like in behind their shoulder blade or something. They're like, no, it hurts here. I'm like, I know.
Yeah, I know.
This is going to help. And then I'm like working away. And then they're like, no, like it hurts over here. I'm like, okay, like I got it. And, and then they'll like,
shut up.
They'll like put their hand up and they're like now it works. Like I got it. So
that's what I like about your treatments is when we go through it, you get me to reassess.
Yeah.
So you'll do some work and then get me to squat. I'm like, how is that pain? Oh, it's kind of better, but I can still feel all right. Lay back down on the table, and he keeps going.
Yeah.
And every time I leave, like my knee's 10 times better.
I think that's like a pretty important piece for just like overall looking for somebody who's like of good quality is to try to find someone who has like some form of outcome measure to say like, have we made a change with doing this?
Yeah.
And that's, I think, probably where in a lot of professions it's kind of lacking. Like it's, somebody comes in, we do this treatment and then they leave and they're like, am I better? Or I don't know.
Yeah, exactly. It's always just like a one size fits all approach.
Yeah.
What kind of like basic lifestyle changes can someone make just to improve their overall like spinal health? Is it basic stuff like sitting with proper posture or exercising at the gym, or are there other things that people can be doing?
I have no idea what you're talking about.
Yeah. I mean, posture plays a role, but if there isn't like, at least we haven't found that there is like the perfect posture. Like I would say,
oh, that's interesting. Really?
Yeah. Like there's better postures than others.
Yeah.
And you don't want to be really in one of them all day, too long.
Yes.
So like the perfect posture is probably a varied posture.
Yeah. Okay. That's interesting.
Yeah, that is.
How many times a day do you guys find that you're like sitting there and you realize that you're kind of hunched over?
Well, I think the three of us are lucky because we're mobile most of the time.
Yeah.
My wife sits at a computer for 9 hours and then drives 2.5 hours home from that, which she drove 2.5 hours too.
Yeah.
That's the same position for more than half the day.
Right.
Yeah.
Like she's bound to have postural issues, right?
For sure. To get back to that question though, like of just like overall like spinal health, I'll kind of even make it a bit bigger of just like overall joint health. And so kind of like, I guess 3 steps here of like, first you want to make sure that you can move that joint, like that you have the range of motion, you have the flexibility. And then it's like, can you move through that range of motion and can you then strengthen around it? And that's like where you guys have a big role in the strength and conditioning world. So like, for the example of a spine, like we could get somebody to do like a cat-cow. Great. Like that just gets their spine moving up and down, goes through range of motion. And if we're really specific about it, it's like looking at like, how do they do that cat-cow, right? So like we kind of want every level of the spine to contribute towards that bend as they go. And so you'll see it. And like their upper back is like great at creating that rounding. But like, if you look at just their low back, it's still totally straight. And it's like, well, now I know why your back is stiff. Like you literally can't move this section of your back, right? So then it's like the intent or purpose of like doing a cat-cow or doing whatever that rehab exercise is with purpose. And I think that's the tricky part with like just the spine is because, we view it as like the spine, like one joint, but like it's so many joints all connected in line with each other.
All with different range of motions, different functions, right?
Yeah. And so like, making sure you gain that range of motion, use it regularly, and then strengthen around it. And like, I'm totally okay with like whatever exercise that is, like deadlifts, squats, whatever, like go for it. Each person has, maybe a certain thing that they want to avoid or whatever, but
So all joking aside, I know you can't touch your toes and we joke about you not doing lower body, but I would love to put you through like a hamstring test.
Yeah.
Because your hamstrings must be deficient on a level of magnitude that yours and mine aren't.
Yeah.
And I'm putting all joking aside. You need to see someone because imagine how much stronger you could be.
Oh yeah. Like
you're a fucking strong kid.
When I did fascial stretch therapy, he was, and I did it to Josh and a couple other people. He was the tightest guy.
Oh, I bet.
If he laid flat, his arm was still up in the air.
Yeah.
Right? Yeah.
Oh yeah.
You got to be seen, man.
And it's like, is a chiropractor, like if someone's to work on their, range of motion, like a chiropractor, would you say is the best person to see for that?
I wouldn't say we're the best.
Yeah.
I think that across like all of those kind of manual physical therapists, you'll see that the people who are the best are like kind of doing similar things.
Right.
So like the chiropractor, physiotherapist, athletic therapist,
They can all
massage, they're all kind of doing like, you know, maybe some form of adjustment, maybe manual therapy, maybe exercise. And then there's like the outliers of like chiropractors who are doing maybe some kind of crazy things, or like physiotherapists that are like just putting ultrasound on it. And then it, like, that's your whole appointment, you know, like, so there's the outliers of everybody, but there's like a good chunk of us that it doesn't really matter what our designation is. We're kind of all doing the same thing.
Right.
Okay. You want to ask your last question, then we'll go?
Yeah. So you alluded to it earlier that you do active release therapy.
Yeah.
What is that and how would it benefit people?
Yeah. So active release technique, or ART, is essentially just a way to get the soft tissues moving. So like, as an example, like there's muscles that run in our forearm here. And so we would shorten those muscles, press on them, and then lengthen them out. And this is just a way to get them to move a bit more freely. So if we like dive into the science a little bit here, we historically would have said like we're breaking down scar tissue, and like the evidence like doesn't really support that. That's probably not what we're doing. It's probably largely on like a nervous system or neurological perspective. So like I was saying with the fascia, or that connective tissue that kind of goes throughout and around the muscle, like it's very rich or very dense in what are called mechanoreceptors. And these are like basically what perceives pull. And so, you know, even just a matter of like going through a range of motion is a good thing, but that additional force of having some type of touch on it seems to be communicating even greater to those mechanoreceptors, and that allows the tissue to move more. So, I mean, first it's identifying like where are those like stiff or tight areas in those people, and why are they stiff or tight, and then addressing them with active release technique. And there's lots of other forms of soft tissue therapy, like you did FST, right?
Yep.
And so it's like another form of soft tissue therapy, or a different brand of soft tissue therapy that we're probably doing like really similar types of things overall, just with like a different brand name to it. But yeah, people who, if you have some type of like limitation in your range of motion, then like that form of soft tissue therapy is generally a pretty effective strategy for it.
And would they go hand in hand, right? Like, so his inability and inflexibility of the hammies, would that be the same with all the fascia that surrounds it? Like you can't treat one without the other. You're going to have to actually treat both. Is that correct? Or
like we're probably treating the fascia more than the muscles.
You are, eh?
But like we like as professionals and as lay people, we identify with the muscle, right? Like we're like,
absolutely,
he has a hamstring issue. But it's probably like deep down in the science, we're probably not really affecting the muscle that much. It's probably more the connective tissue fascia that surrounds it.
Awesome.
Yeah. But there's like, even just to get back to Corey's, like there's so many like intricate kind of levels to it. Like sometimes people can't touch their toes, but they actually have like really good length in their hamstrings, right?
So what's the limitation then?
Yeah. So they possibly just can't control or can't use their hamstrings, right? Like there's people that can't touch their toes, but when you get them to lay on their back and you lift their leg up, like they can go past 90 degrees kind of thing.
Yeah. It's not me. I can tell you now that that's both. Yeah.
Well, I heard that. I heard that. That's like my hip.
Straighten his elbows.
Yeah. Like not directly above my head.
Yeah.
Get this guy.
Like, come see me.
But
I will be making a visit.
Yeah, you do, pal. You do for sure.
Can we start a GoFundMe for Corey?
All right, so let's do some rapid fire. I don't know who the fuck printed these off, but it's like Garmin 2. Hold me, let me just put it out here for fuck's sakes. Okay. If you could work not in the fitness or health industry, what would you pursue?
Addictions counselor.
Love it. Attaboy. Right back to home, right?
Yeah.
Yeah.
I'd go into like carpentry or woodworking.
Would you really?
Yeah.
Well, you're like good with your hands, so that kind of marries the both, right?
Yeah, like I don't know, I just love it. Even like when I'm at home, that's like a hobby.
That's a hobby?
Yeah.
Very cool.
I would say some kind of like investigation, like
PI work. So as little as possible with physical energy.
Yeah.
You just want to sit in the car and just watch people all day.
Yeah, undercover.
Yeah.
Buddy, your ambitions are overwhelming.
He could put on he could just put more like Oshkosh.
Oshkosh, yeah.
He can blend right into
The
the
blend
park.
rating, or you go to the playground and be looking at the teacher. Yeah.
It didn't matter what my answer was, Chris. These
No,
guys-
you're fucking getting buried today.
What was
pal.
Destroyed from the start.
Buddy, I waited a month to have
been a
at you,
while.
so I'm having at you. I would go into acting.
Yeah.
Yeah. Yeah. I think I'm a little
that'd
bit
be
of a
fun.
ham and I could just go for I have no problem with embarrassing myself, which I'm sure will come up several times today.
Yeah.
Okay, I'm gonna name the city. You gotta name the most famous landmark.
Oh,
I'll
fuck.
start you with an easy one. Toronto.
CN Tower.
CN Tower.
Well, you were first. Good job, pal. Paris.
Eiffel
Eiffel
Tower.
Tower.
Eiffel Tower.
I beat you, sucker.
Rome.
Fucking
Colosseum.
Coliseum. Yes. Here's a toughie. Sydney.
Australia. The Opera House.
Yeah.
Atta boy.
Yeah.
Good one. NYC.
Statue of
Empire
Liberty.
State
Yeah.
Building.
And both.
Empire
Both.
State.
They're both good. Okay. Last one. San Francisco.
Golden Gate
Bridge.
Bridge.
Yeah.
Fucking buddy. See, you were worried. You nailed that. If you could have an unlimited supply of one thing, what would it be?
Leg gains.
Better shoot for the
Quads.
stars again, pal.
Quads.
You want leg gains to sit in a car in your second career all day.
Yeah.
That's perfect.
Oh shit, man. God, I got so many
Time.
options.
Time,
Time.
That's a good
Time.
That's a fucking
maybe
good one.
water,
Bourbon.
food.
Yeah. Oh yeah, that'd be good.
Okay, what is the ugliest thing you've ever seen?
Corey.
I'll
I
start
walked by
with
Jeff the
you.
other day. He says, "You look good today."
Yeah.
I was like, "Thanks, man. You too."
Yeah.
Who are you with, Pam?
Pam,
Real
it was
wholesome
Pam.
conversation.
Yeah.
What's the ugliest thing you've ever seen? And obviously, patient doctor privilege has to stay in order with that one.
The ugliest.
I don't know. That's a tough one. I can't really.
Yeah.
I know that
So I
commercial.
Googled the ugliest dog.
Oh, there's been some.
Holy shit. That thing.
It's that
was
like tiny
wretched.
one with the
Okay,
teeth.
right.
It's tongues dangling. It looks like if a dog could be a drug addict. That's what it would look like.
The ugliest thing that I have ever seen is Amanda Mauer's cat.
Yeah, it looks like a giant
That's-
nutsack.
Okay,
it's
yeah,
like
that's
that.
okay. And let's also call a spade a spade. Some babies are fucking ugly.
Oh god, yeah.
I can't say people. Oh, they're beautiful. No, they're not.
Yeah.
Fucking look at that kid.
Yeah,
Totally.
well,
Fucking looks
I
like a
will never
roadmap.
lie.
What's that?
So if I see an ugly baby,
Yeah.
I will not say, "Oh, look how."
Oh, me
cute."
either, pal.
I'm
Yeah.
just like,
Oh yeah,
You must love it.
Yeah. You must love it. And it's an it. Apparently. Yeah. What is your beverage of choice, Doc?
Ryan Ginger.
Ryan, what kind of rye?
Crown Royal.
Attaboy.
lately it's been bourbon on the rocks.
Bourbon on the rocks.
Yeah,
nice. Oh, very nice. Like my bullet.
Apple juice box.
Jeez.
No,
You're killing me.
I don't really
You're killing
drink,
me.
so
No, you don't.
No,
That's
but
true.
he
too.
doesn't even
yeah.
have water.
Yeah,
It wasn't
just
water,
He doesn't have
though.
water.
Water's
not- Yeah,
like
not even
real
No,
water.
fucking Jaeger bombs, bud. That's your
yeah.
drink.
When
Oh,
I
yeah,
yeah,
Jaeger
or
bombs.
Jaeger bomb.
Or-
It is on social media.
Yeah, I already know what it is.
cherry whiskey
What?
in ginger ale.
Nikki's
Yeah.
dad has given me
God.
cherry whiskey and
Yeah.
ginger ale.
So when
and
he
I
was
like
drinking that,
You
I'm
have
like,
way
yo,
too
where'd
many
you get
X
that from the
chromosomes, man.
retirement community?
Way too
Like,
many
fuck.
chromosomes. What is your favorite series, TV streaming series of all time?
it. Suits.
Oh, that's a good
Oh,
one.
That is a good one.
That is a good one.
Suits.
I can't usually rewatch shows after I've watched them,
Yeah.
but Sons of Anarchy
Number one for me, pal.
or Breaking Bad.
Buddy, those are 1-2 for me. Actually, and Ozark's now up there.
Oh, see, I haven't finished.
It's an
it.
old one though.
But Sons of Anarchy is number one for me
Yeah.
too.
I
I'm surprised you
actually
didn't
watch
say
very
Friends.
little TV.
Do you?
Suits
Yeah.
is-
So you don't
Um,
stream a series with your wife and binge something for
We do,
7
but,
days?
like,
You got to
it's-
try it. It's great for the
it's more
marriage.
time.
To say I'm
Documentaries?
just like I love this one series is tough.
Doesn't
Like I
stand
would
out.
say Suits was a good one,
Suits
but I
is a
still
good
don't
one.
even know if I made it all the way through Suits.
Yeah,
Like,
it's
I don't
true.
know if I've.
I didn't even know that the girl in that was like the wife of the
The Prince Harry.
until like
Meghan
season
Markle?
4. Yeah, like I
Well,
had no idea.
She wasn't the wife during season 4.
Oh, she wasn't.
No.
Oh, okay. Well, no, I didn't even
When
know
she
that was
left
her.
the show,
She left the
that's
show
when she-
Oh,
because,
that-
yes.
oh,
Yeah, she had to leave the show. Would you rather go to a movie or to a live play?
movie.
movie.
Yeah. Movie.
Oh, you fucking
don't know if
guys
I've
are
ever seen a
boring.
live
Have
play,
some
though.
culture, man. Okay, if you could be teleported anywhere right now, where would you go?
Back in time.
Oh, that's a good.
Okay.
That's a good one.
Where would you?
Yeah. Okay. If I'm not going to steal that.
Yeah, I know. Because typically 5 out of
You
10
brought up
steal.
Sydney. Like I'd love to get over to Australia.
Yeah.
Yeah. I was
That's a
gonna,
bucket list for me too.
I was going to say like Italy or something.
Italy's good
Yeah,
too.
yeah.
But I'd pick Mars. Like, get me the fuck
Where?
off this planet.
Mars?
Get me the fuck off this planet. I'm telling you, it's imploding. All right. This is for you. If you were arrested with no explanation, what would your friends and family assume you did?
Fuck. I mean, I think there'd be two. It's either I relapsed or I beat the shit out of somebody.
Beat the shit out of somebody? Fair. Doc?
Oh, I thought this was just for him.
No. They're always for everyone.
Yeah, I don't know.
For me lately, it would probably be some kind of road rage.
Really? This commuting to Mississauga is killing you, eh?
It's honestly, it's just the intersection right by the gym.
Oh yeah, that's pretty bad.
Yeah.
It is a bad intersection.
I think like if for me, I would probably like just have some like very minor thing, a tail light out.
Yeah.
And then I'd be like, I'm not stopping.
All right, he's got some fight in him.
In the movie
like it.
Walking Tall with The Rock, you guys seen that?
Yep.
And he pulls that guy over and he goes, yeah, you might want to get your tail light checked. He goes, what's wrong with my tail light? He gets a baseball bat and smashes it. And he goes, it's broken.
All right, last one. And I know we're all spoken for here, but I'd like to have the audio version of your Tinder file. And I want it done in the voice of a bratty little kid.
Like what your bio would say?
Would say in Tinder, yeah. It's got to be in the voice of a bratty little kid.
A bratty little kid.
Yeah, like, oh my God, like I'm so good looking and I have shoulders the size of boulders and damn it, I like to go for long walks on the beach.
All right. Oh shit.
First, I got to think about what my Tinder bio would say.
I know, right?
Yeah, you just flex.
And then,
flex.
I like long walks to the fridge. I don't train legs, but I got a great personality.
Nice. Yeah. I like it.
Short as fuck. Yeah, I'm tall. I have a beautiful beard. And I know my love languages.
I have an OnlyFans.
We are rebranding.
Yes.
Rebranding.
Doc, do you want to go with that?
Yeah. Here we go. I love the outdoors and I have a great smile.
He does.
Deep down romantic.
Nice. Love it. Doc, thank you very much. Appreciate you coming back and doing a repeat with the Kultured Kast. And gang, we'll see you next time. Please like and subscribe our YouTube channel. Talk to you soon.
Bye.